Alright, let's talk about something that most people with a uterus deal with, but pretty much nobody actually wants to talk about: period pain. Or, if you want to sound super fancy or impress your biology teacher, dysmenorrhea. Now, dysmenorrhea is just the medical word for those painful cramps you get around your period. It's totally normal to feel some cramping, maybe even a little tired, nauseous, or yes, making way too many trips to the bathroom. For most people, this discomfort shows up the day before or the day you actually start bleeding, and then chills out after a couple days. But here's the thing. Sometimes, it's not just a little annoying. Sometimes the pain is so bad it stops you from living your life, hanging with friends, or even going to class. If that's you, I hear you. And you're definitely not alone. There are actually two types of dysmenorrhea. First, primary dysmenorrhea. This is the classic period pain, not caused by any other medical problems, just your normal cycle being, well, kind of a jerk. The pain usually starts a day or two before your period and hangs around for 2 or 3 days. Then there's secondary dysmenorrhea. This one's a little more complicated because it's caused by another condition, like endometriosis or fibroids. The cramps can start earlier in your cycle and last way longer. If your pain is off the charts or sticks around more than a few days, it might be time to check in with a healthcare provider. So why does it hurt so much? Blame prostaglandins, a chemical that tells your uterus to contract and shed its lining. Some people just have higher levels of this stuff, which means stronger cramps. Everyone's body is different, and there's not always a clear reason why your cramps are worse than your friends. Here's what those cramps can feel like: throbbing pain in your lower belly, pressure, pain in your back or thighs, and maybe some bonus symptoms like nausea or dizziness. Fun, right? How do you deal? First up, over-the-counter painkillers like ibuprofen can be lifesavers. Heat pads are another go-to. Just pop one on your belly or back. Some people find relief with exercise, yoga, or eating anti-inflammatory foods like leafy greens and ginger. And honestly, sometimes just chilling out and resting is the best medicine. But if your cramps are making life miserable, don't just tough it out. Talk to a doctor. There are treatments like hormonal birth control, stronger meds, even surgery if it's caused by another condition. Bottom line, mild cramps are normal, but severe pain isn't something you have to suffer through. Keep track of your symptoms, and don't be afraid to ask for help. You deserve to feel your best every day of the month.